Cystic fibrosis is a common, chronic, recessive genetic disease that affects the lung, the pancreas, the liver, and the reproductive organs and the intestines of an individual. In recent years, the research into the pathophysiology has recognized that a range of clinical manifestations are related to this disease. The cystic fibrosis transmembrane conductance regulator gene, the CFTR, was discovered, and since then there have been over 2,000 different variants of this gene. The mutations such as the F508 del mutation and the impact that this has on the individuals with this disease has been reported and recognized across the medical field. Since its discovery, there have been numerous influential management strategies to help the course of treatment for those affected by this disease. Cystic fibrosis is usually recognized as a lung disease. However, there are many clinical manifestations of cystic fibrosis, and they are very widespread. They present as bronchitis, respiratory infections, pancreatic issues, reproductive complications, and this is all found in the paper by Anwar et al., which is cited on screen. Diagnosis of cystic fibrosis is typically done in children as a screening test. If this comes up positive, then there are further sweat tests performed to get a definitive diagnosis, found at Brown et al., 2017. Furthermore, pulmonary radiographs are used to monitor the progression and help with the treatment of cystic fibrosis. The disease itself is a mutation of the CFTR protein that is responsible for the movement of chlorine and sodium ions through the CAMP-dependent channels in the epithelial cells, from Anwar et al. 2024. A diagram, figure 2, can be seen on the screen, which shows the process of a normal airway versus the airway of somebody with cystic fibrosis. These mutations occur on the 7th chromosome and lead to molecular abnormalities that affect the structure and the function and cause insufficient chlorine transport across these membranes. Depending on the type of mutation, many times the channel is not present at all within the membranes of the epithelium. The CFTR abnormality results in higher sodium absorption due to a decreased chlorine transport, which can be seen in figure 2, part B. This causes irregular distribution and water retention of the fluid within the cell, affecting the mucus composition, which can lead to a number of problems within these organs. As you can see in figure 2, part B, there is a buildup of mucus outside of the cell. There are a vast majority of management and treatment options of cystic fibrosis. This is obviously dependent on how far the disease has progressed and the damage that it has already done to the body. Common treatments are breathing treatments, annual vaccinations, and the treatment of symptoms, which is found at Brown et al. 2017. Clearing a person's airway is the most important management for all patients to maintain lung function and SpO2 levels. All patients suffering from cystic fibrosis should undergo flutter valve therapy, which is the device pictured in figure 4, which is focused on expelling the mucus from the airways. Another common treatment is a high-frequency vest-assisted chest wall auscultation, which is where a person wears a vest similar to that of figure 3 to loosen and break apart the mucus so that a person can cough up the mucus buildup. The person wears the vest and it vibrates while also using the flutter valve therapy device to breathe in and out, which expels the mucus. They will also cough and try to bring up as much of the mucus as they can. CRTF modulators are a common pharmacological treatment and management option for patients suffering with cystic fibrosis. A common drug used to treat cystic fibrosis is tezofactor and ivafactor, which is a potentiator in a class of drugs called the CFTR modulators. Tezofactor is a CFTR that targets the underlying causes of cystic fibrosis. It gates the mutation and it allows for the chlorine ions to flow through the membranes and enables for an ion equilibrium. This can be seen in figure 5. It acts as a corrector and enables the CFTR proteins to come to the surface of the cell, which is seen in this diagram here. When used as a combination drug with ivafactor and other drugs of this class, there is an increased function of the F508del mutated CFTR protein, which can drastically improve the chlorine ion transport. Tezofactor and ivafactor and other drugs within this class are absorbed and reach a half-life at 6, 3, and 4 hours, depending on the type of drug used. A pharmacological intervention like this will help Jacob in the management of his disease. If he begins to take these medications, the chlorine in his cells will begin to level out and move towards an isotonic state, breaking up the mucus, and with other physical management mechanisms, there is a good chance that Jacob's respiratory issues will continue to improve. He will be able to expel the mucus of his lungs with the mechanical management strategies that are listed above.